three very exciting panelists with me. Srividya Sunderamurthy, who is the founder of ColigoMed, Dr. Manish Sheth, who's founder and CEO of Headlight Health, and Dr. Anastasia Chemeritskaya, who's the founder of Lyrana.
Hi everyone, thank you for the opportunity. My name is Srividya Sunderamurthy. I'm a co-founder at ColigoMed. Coligo stands for unification in Latin, and I've been the co-founder and head of product for the last 4 years. My background is mainly in product management. I've been building software products for the last 25 years or so. I'm glad to be here.
Yeah, hi, I'm Manish. I'm a psychiatrist by training, medical school and MD PhD. Been a psychiatrist for 25 years. And I have really focused, our organization has focused mostly on the access. We heard a lot about access, and we'll talk about it for mental health care. And currently I'm leading Headlight Health, which is a mental health clinic with clinicians, psychiatrists, therapists, and counselor.
My name is Anastasia Chemeritskaya. I'm a physician, researcher, and also founder of one company. My background is OBGYN, functional in integrative medicine. So I'm in longevity space and expert in peptide therapy. And Lyrana is a concierge wellness and longevity platform internationally.
Can you tell us a little bit about ColigoMed? What exactly do you do, and how can it help for people to live longer?
Before I start on what ColigoMed is, a bit of everybody's been, talking about stats. A little bit about stats on the U.S. Healthcare. As you know, it's very fragmented, but also there is a growing problem where there are around 170 million people who are with chronic conditions. And that's the number that we are going to deal with. And it's not just one condition, they have multiple conditions, which means that every patient is probably looking at a primary care doctor, a specialist, and a dentist and eye specialist. So, but the data itself doesn't really stay in one place. It's floating around, it's in silos. And I'm pretty sure Dr. Nidhi, you being a dentist, and Dr. Sheth being a mental health specialist, if you get a patient who has gone to different doctors, you probably wouldn't get to see what is the primary care doctor saying or what is the heart specialist saying about the patient, unless that's the problem that we looked at when we started ColigoMed 4 years back. Our mission is really to see how we can bring all the patient data together so that on top of that, we can provide the insights and the knowledge that a doctor or a care team member or a nutrition coach or a dietitian should know about the patient. They have the full history, the full insight, and and in a very concise way, they can really tell what the patient needs are, and then based on that, they can put their diagnosis and decisions based on that. So that's what ColigoMed does. We started our journey 4 years back, and we have got, we help providers, hospitals, health systems streamline their care delivery, care coordination process so they can scale and they can provide maximum coverage for their patients between visits, and they know exactly what's happening with the patient outside of their ecosystems. When the patient is at their home settings or remote settings, we do a lot of remote monitoring and chronic management on the patients so that the doctors know what exactly has happened or what is the patient facing. A lot of those things are available very easily to the doctors.
Why aren't all of us thinking like this? What are the obstacles you have?
When you look at the fundamental data layer in the healthcare system in the US, it's driven by the EMRs. I think there was a lot of focus put on putting the data in a digital format in the electronic medical record systems. But as time passed in the last decade or so, there have been a lot of EMR systems and everybody wants to compete in that space, and none of the EMR systems are talking to each other. So that's when we got all these different protocols like FHIR, HL7, RPA, all of those things have come about to basically see how the doctors can get access to the data. But the thing is, doctors are not technologists, so at least they need help. They are basically focused on trying to meet the patient needs and take care of the patients, not necessarily bring technology together. That's our job as technologists. This is our job, to make it easier for the providers, to make it easier for any clinician to see the data in a logical way and in a very easy way. So that's one of the big blockers at the systems. There is a lot of fragmentation in the systems, in the way the care is delivered, in the way the data exists in the healthcare system.
And will this belong to the patient as well? Will the patient have
Absolutely.
access?
Patient owns the data. Yes.
Patient owns the data.
Patient owns the data. Patient should always have access to the data.
Super excited about Headlight Health. It is revolutionary, and can you please tell our audience like what exactly does it do?
As I said earlier, I have been a psychiatrist for 25 years and been in the field, been on the research side as well. And one of the things we realized being in this field is, first of all, there is stigma at the individual level. We heard about how cancer also creates stigma. Same thing with mental health. Like people do not want to go out, talk about their depression, their anxiety and whatnot. First and foremost is to create a system where people who are able to get through their stigma are able to access care. Typically in most communities, and we are talking about urban communities, not even rural communities in US. In urban community, if someone would try to get mental health care, it's at least a 90-day waiting period. On top of it, it may or may not be covered by the insurance. More than 50% of the providers in urban system, mental health providers, are not paneled with payers or insurance. So if you talk about the barriers, stigma being one of them that we all talked about, which is being at the individual level, stigma has improved. For this panel, what I wanted to focus with the slide is to what can we do and what are we doing for older clients. So statistics, most of you folks are data-driven folks here, and I wanted to bring some epidemiology, some data, is that 1 in 4 US adults over the age of 40, adults, seniors, have mental health condition. We are talking 25%. And less than half of them receive any mental health care professional support due to lack of access or or due to the cost, as I said, because it is not covered by insurance. And those who are not getting mental health care, but also those who are in the social isolation, 29% of them have higher risk of heart disease, 32% increased risk of stroke, 43% feeling lonely. They are reporting that on a day-to-day basis. These loneliness and isolation is as harmful as smoking 15 cigarettes a day. Again, this is data. This was an advisory which was published by US Surgeon General, Dr. Murthy, in 2023, 90-page booklet basically, which was published to show how loneliness is impacting our community. It's like a national emergency where we have to address it. The lack of social connection is impacting, causing negative outcomes more than obesity, more than diabetes, more than not having physical activity, more than alcohol or smoking use. So something that has to be very deeply addressed, especially for the senior population. When we talk about longevity, certainly mental health care is one important piece for that. How do we do things at Headlight Health? We have used technology on the front end and on the back end while we are still protecting the sacred time, the sacredness of a clinician and the patient. A lot of discussion about data, technology, AI. As doctor, I notice that we are missing the talk about the clinician themselves. Where is the clinician in this big picture? And what we are trying to do in our company is we have technologists, data analysts, engineers who are creating tools so that the access to the clinician is easier for an individual client. And once they see the patient, then the follow-up care can also be all organized using data. We are in 7 states. We have over 250 clinicians, and we are recruiting more, and we are serving 1,000 patients a day in mental health field. It's pretty big in terms of the numbers that goes through. It takes 25 working days or more to see a mental health client, but in our program, we try to see them in less than 9 days. If someone needs mental health service, you can't tell them wait for 2 months or 1 month or 3 months. In the industry, 50% of people keep their first appointment once they are booked. In our setup, we have more than 80%. And again, this is where we are using technology to send reminders, to keep patients engaged, to create various touch points using some of the AI tools and some of our personally developed tools. Once a person comes to us, generally 70% of the time in the industry, they come for a second visit. Second visit is very important because otherwise we have lost connection with them. In our program, we have 92% of the time our patient comes for the second visit. Fourth visit is what the payers are using now. So we work with payers. We are paneled with all insurances, because unless we go with the insurance, and if you're not within network with the insurances, then there is no access to the patients. industry averages, generally the patient comes, 36% of the patient come for fourth visit, which shows therapeutic alliance. In our program, we have over 90% of the patients. They come back for up to 4 appointments with the same provider. Point is that we are using data for increasing the access and making sure the follow-ups happen, the insurance filing happens, the credentialing happens, so that the clinicians are not wasting time on those administrative work that otherwise swallows a lot of their time.
Dr. Chemeritskaya, please tell us more about Lyrana and how women's health is important. And one of your things is like the peptide therapy and the hormonal therapy. Tell us a little bit more about that.
Yes, Lyrana, it's, as I mentioned before, it's concierge longevity wellness service. We more focus on female health, especially like female like after 30, 35, and like perimenopause and postmenopause period. We provide personalized care. I don't like word longevity. I believe we have to be more precise about when we're speaking about this. We have to divide it to health span and lifespan. Lifespan, I will give it to the biologist, genetics, and all AI drug discovery. But health span, it's like I believe we are as a clinicians have to be focused on. And we provide this service internationally. We also have a partnership with clinics around the world, because now, unfortunately, for example, in the United States, we don't have access to all type of care. And I always speak about like what is heartbroken situation for me was as a clinician, especially when I moved to United States. A lot of women was lack of access to hormone replacement therapy due to huge study, and it was like really for few generations, and now FDA finally is ready to reconsider it. We provide hormone optimizations, hormone replacement therapy, peptides. I was also like, I have a privilege to study with, from Professor Covinson, who was a pioneer of peptide in the world. He developed it in 60s and Soviet Union time, and I believe this is one of the best signals molecules, which can help also to delay perimenopausal changes. Any woman can say who is going through perimenopause that she can like admit how many changes she's going through. And especially even in mental health is highly important too, because unfortunately not only neurodegenerative diseases is come out in this time, it's also like any mental health issues too, and we need to be more precise and more personalized with our approaches. And also Lyrana is building agentic AI as well. What I believe is the best way to personalize care, it's to study your patient, your client, like from lifestyle, like from how its morning start, what kind of workflow she has, how many children she has to care of. Like we need to really understand how to make for her life easy and personalize our approach, not just like personalized by what we prescribe, how we prescribe it, delivery system, like anything which is really can affect her daily life basis. That's what I believe is going to then actually next in healthcare. Personalized medicine, and AI will help us. Of course, we have a lot of concern with hypersecurity, with the data collection. Yep, that's what Lyrana is about.
Let me give you some examples of like when coordination doesn't happen. I had a patient from London who was trying to get pregnant, and she spent, and IVF treatment is not cheap. She went through rounds and rounds and rounds of IVF treatment, not successful. She came to me not for pregnancy issues. She wanted to get her teeth fixed, and I said, "You have a very infected tooth." And she's like, "Oh, I couldn't go to dentist for the last blah, blah, blah years because, I was so focused on my IVF, and now I've given up on having a baby, and now I want to look the best, and I want to have really good teeth." So I said, "You have to extract this tooth. This is very infectious." We extracted her tooth. 2 months later, she got pregnant without the IVF treatment. She wanted to name her daughter the same name as me, and I said, "Please, your daughter will not forgive you. You are, of a different nationality. Keep her name." But that's how helpful. Another example is, this was a dad of an Indian patient who had very infected teeth. He got septicemia, and he was admitted to the ER. They started amputating his toes, like really aggressive, because it was like they couldn't control the infection. So I went to visit him and I said his teeth are really infected. Once they extracted the back molars, he was feeling much better. So coordination is very, very critical. And I'm so grateful that, your company is doing that, because having that synergy between like the different specialties. Same thing with estrogen.
Yeah, I can comment on that
Yeah.
actually, because I practice also medicine in Russia. And for example, the first person where we send any woman with a fertility issue, it's a dentist. It's like protocol. It's actually like we follow this protocol. It's not. I travel a lot. I was doing medical tourism too. That's why not each country has this protocol, but we had it in the. I don't know how it's going now, but it's really important. That's what you did. You just get this infection like locus, and it's why she was healing. It's beautiful. Thank you so much.
1930, which is 100 years ago, people were not brushing their teeth, and Pepsodent could not sell a single toothpaste. So they hired this very clever marketer called Claude Hopkins, who's like, how do we make, people, how do I make the sales of Pepsodent go high? So he started doing this marketing, and especially for like women, like if you have the yellow film, and maybe we can pictures, like if your breath smells good, if if you remove the yellow film from your teeth, you're going to get a date easier. Your teeth are going to be pearly white. This was 100 years ago. And he also said in like little like those one of these flyers, he even said only have to visit your dentist twice a year. Have you guys heard of that? Insurance companies only pay for twice a year cleaning. I want to talk to Claude Hopkins. Even he must be crying from the skies, because what did I do? People have this notion that if they brush their teeth like really hard, they're going to have this pearly white teeth till today. But they only brush like the front part of their mouth. They don't they miss all the back molars. It's so tough. You're using a stick and thread to clean your mouth in 2025. Here we are talking about AI and quantum and this and that. Sorry, I can't even pronounce some of the things. But for brushing, which is like I feel like mouth is the gateway, is the mirror for our image, like this for our body. It's we see so many signs. Like if the estrogen level, when menopause women, their estrogen level goes down, it starts affecting their bone, their teeth. And if you go to a regular normal dentist, they'll be like, get your cleanings like 5 times a year. That's not the right thing, because our mouth is just not teeth. It's not just like teeth. We have so many important things in our mouth. We have the saliva, which is like, like our savior. We have the tongue, we have the back of our mouth, and the gums, which has like such amazing hormones and protective enzymes to protect us. And we just brush them away. So if anything, if you guys go home, when you look at your brush, please do not please do not think that over brushing is going to give you better oral hygiene. And it's not your fault, because it's that marketing which has done that, this notion that we are going to have white pearly teeth. That's great oral care. And one video we're going to show.
What if clean could be faster, smarter, even effortless?
I brush twice a day and I floss all the time, but I'm still getting cavities.
I mean, will this device even help people like us?
ZERObrush is designed for people like you, 5 years old, 50 years old. All of us have the same problem.
Americans' dental health is worse than ever. 50% of adult population suffering from gum disease. It is an epidemic, and it is not improving.
Despite all the patients putting so much effort, still seeing the gum recession, still seeing cavities in the back molars, it was frustrating for me that I couldn't help the patients.
Humans vary a lot.
By using technology to automate the rest of the pipeline, they've been able to offer that custom piece to people.
The idea is that this could be for everyone. We can make a personalized product.
Yes, so my
and
hope.
very positive unit cost economics. It's not about disruption for disruption's sake.
We have chosen the hard road specifically to help our customers versus taking sort of the easy way out so we can make a quick buck.
Fresh clean like a dentist cleaning is something that a consumer said. Not having to think about brushing my teeth, that's something a consumer said.
Like, that's the coolest thing ever.
I finally tried it and I had this aha moment. I was like, oh my God, this is why people are going to love this.
It gives you hope that you can change your oral health if it's not as good as you want it to be.
We want to improve people's health. And that is the driving factor in all of this.
Finally, there's a product which we can trust.
ZERObrush, the future of clean.
It really made my mouth feel like super fresh. It felt like I brushed and used mouthwash and floss all in one.
It gave me that dentist feel clean after I used it.
But the fact that it was actually tailored to my mouth, it was perfect.
The best part about using ZERObrush was that every time I used it, my teeth felt as if I came from a cleaning from the dentist.
So thank you, all of you. Is there anything, Dr. Sheth, especially for mental health, can you give us some tips?
Yeah, no, I mean, first of all, great comments from all of you, the panelists here. Even before going to individuals at the institutional level, I would say there has been discussion about more investments, more research and development. Mental health, again, the most research and development R&D we have seen over the last 30, 40 years is in the pharma side. That we had, starting from 1986, 87, when Prozac came out, that was the first major drug that came out, which changed the way we treated people. And until then, we used to admit people for 30 days, 60 days, 90 days for minor depression even. And Prozac came out, and we started giving prescriptions to people to take home. And because someone could, and I have to say this because as a psychiatrist, we always worry about this. If someone were to overdose on Prozac, they are unlikely to kill themselves with it. And they would be treated in the hospital later. Whereas other medication that existed until then, antidepressants, if someone just overdosed on a week worth of medicine, they may not survive. So Prozac was a big game changer. And then for next 3 or 4 decades, we had bunch of different meds. I would say maybe a couple dozen different medications that came out in the market, brand name, so that they would be promoted. You will see ads on the TV, and then once they become generic, their cost from $1,000 a month will go down to $10 a month. But interestingly, in last probably 5 years, there hasn't been huge pipeline of new drugs coming in because all the neurotransmitters they typically think of have been addressed. Serotonin, norepinephrine, dopamine, glutamate, NMDA receptors, and so forth. Interesting part is, in last 5 years, we have been hearing a lot about psychedelic drugs. MDMA, there is a product of ketamine that is now FDA approved that we offer from our clinics. Psilocybin has been studied. There has been a lot of capital that has been invested in companies which are researching psilocybin, MDMA, and so forth. And you will see that more in the news, whether you are on the research side, data side, or investment side, you'll see those opportunities as they grow. What I would ask is think of investment in mental health. Individually, people have become destigmatized. People are willing to talk about it. If we are 20 people here, 5 of us can benefit from a therapist or a psychiatrist, 1 out of 4. In this crowd, individuals are willing to talk about it. They're talking about that on social media and whatnot. Now it's time for institutions to take on the baton. Think about investing in this. I love the product that you have. Part of the challenge also in US and everywhere else should be the privacy of data. All kinds of healthcare data, but more so for mental health data because it has additional legal compliance requirement from federal and state level to protect that data. So as much as we all want to work together, sometimes it becomes harder to work because of the compliance issue. And when we have products like yours where it's easier to get, it's one platform where we can get all the consents so that we can share data, that makes it so much better and so much easier. I mean, in other conferences and meeting with other data folks, I've heard that about 90% of the EHR data, the medical data that doctors have access to is not looked at, which is sad. That we create all this data, but nobody's looking at it. So we would love to see AI tools which can then summarize this data. Because, if I get a new patient and I have 100 pages to read, I'm not going to be able to on each person or 1,000 pages. So if there are tools that can be developed which can concise, make it summarized, that would be something huge for us as an industry. But on the individual basis, I think we believe in prevention. So all the basic things that we recommend for healthy life, exercise, diet, sleep, things like that. Then once we go past prevention, where someone is having symptoms, then seek help. People generally ask me this question is what is the threshold to see a therapist or a psychiatrist? The answer is, the moment you think about it, go see one. talk to a professional. Like they will tell you that, oh, you know what, these are like existential things. You know, I can refer you to a coach, start going to gym, make these changes, and then see me in 6 months, or you need to see a therapist every week for next 6 weeks. So see, you know, I mean, there are tools, there are screeners online, but generally, I would not support them to be used for your personal mental health care. And then finally, you know, if someone is recommended to take medications or do TMS or do Spravato, which is ketamine-based treatment, there are a lot of advances in mental health field, by the way. Today's topic wasn't there to cover for all those of the advancements, but I would say, you know, creating that openness and social networks. Social isolation has been found to be like number one reason whether it causes depression or depression leads to social isolation. Either way, it's a big factor in having negative outcomes. People have more strokes, more depression, more worse metabolic effects, obesity, early mortality. Longevity cannot happen without a good mental health care. That's what I would say.
One thing when you are having a mental crisis, it's another thing when a loved one is having. I found out that unless you yourself go and seek for mental health, you're not allowed to you cannot say, oh, my spouse or my so and so person can seek mental health. Why is that? Because obviously the person who's going through may or may not understand what they're going through. How do you overcome a barrier like that?
The reason why is history. If you look at 100 years, 150 years of mental health care, there used to be some things that were done that we are not proud of. They used to instill probe in the frontal lobe through the orbital for people who had schizophrenia or bipolar. Yes. Someone actually got was the time of the year person award for doing that procedure. So history has created all this stigma around mental health services, but I think over the last 20 to 30 years, as there is more openness, and I think if there was one thing that happened with COVID especially, is that the awareness for mental health came to the forefront. Celebrities, athletes, Hollywood or movie stars, they came out and they talked about their depression. I mean, you hear this tennis star saying, well, I'm pulling out of my tennis tournament because for mental health reason. Mm-hmm. You couldn't imagine anyone saying that 10 years ago, 20 years ago. So, I mean, that awareness has clearly happened, but it has not happened far enough to change what you're asking. Mm-hmm. People have rights. People's rights were abused in past in the name of mental health care. People were being put into, whether they were for political reasons or personal reasons or financial reasons, people were getting locked up in facilities for months and months and being told that, oh, you have a mental health condition, you cannot have your children, you have to be locked up, you won't be, So that's why government has gone, we as a society have gone the other side of it, is making the laws very strict so that, the personal rights are protected.
Same question for you, because, there's a lot of depression and low energy near the menopause age. And a lot of women, culturally, they are very hesitant. So maybe, people who are listening, you may want to tell the benefits and remove the stigma from using hormonal therapy to feel your best. Because all of us, we want to live longer, but more importantly, I think we want to live healthier. And so how can, maybe a message to all the women who are listening?
What's about hormone replacement therapy? It's still have to be considered as a therapy. You cannot prescribe it everybody. That's why, but what is making me sad, unfortunately, after the Women's Initiative study, all majority of providers, they stop even consider the therapy for anyone. They just say, okay, it will pass. Just symptomatic menopause, it will pass. Or I will prescribe antidepressant for you. That's what is a good approach to do something, but sometimes we need to do really pathophysiology, to look at the pathophysiology of the process. Why, when we have a decline of progesterone, estrogen, which really affect the brain a lot, we have all of the symptoms. And my message, I hope like all providers, especially after this FDA reconciliation of the therapy, they will start to look at the therapy more widely and to do evaluation for each patient, like benefits and risk. We always go in between benefits and risk. We have to, and I'm sure it will be more widely prescribed. And women will just feel much better on it. I also has a background at breast cancer research for a few years. And honestly, I can say breast surgeons, oncologists, they actually, I think they more kind for this therapy than even OBGYN sometimes. And internal medicine physician, they also look at this. They look at this more than OBGYN because they feel the benefit for cardiovascular prevention. The best way, actually, education. I believe with AI, we will have a much better and educated patients. This is what they will seek this treatment. They will ask us. We will educate ourselves more and more, and each this point. That's why I have a lot of hope for AI, which will really give more information to the patient, even without providers. Even providers have to be leaders in this field. But still, we will do from different part, just to put awareness first, that the patient can seek this treatment too. Yeah, and I would like to add also, for example, peptides, and it's from my practice as well. The interesting part when I was kind of developed these protocols, peptides protocols, even back home in Russia. My gosh, I got 3 dentists as a patient. After that, I was booked for 3 months ahead, mostly because it's really helpful also for gum repairing. Yes. That's why, and estrogen also. When you little bit start to prescribe transdermal estrogens, all dentists was so grateful. They even call me and say, "Okay, thank you so much. We have a less complication even on any procedures." That's what I believe we have to think about health holistically. That's what my message. And don't look for this symptoms. Do prevention. We can prevent so many diseases, and that's what the best. Just check on it, educate yourself, ask your providers, push them to educate themselves. This will be new healthcare.
Just one question. I know you probably, it may be out of your scope, but GLP-1, does that help with mental fog?
We prescribe GLP-1. Again, I'm a psychiatrist. I'm not a metabolic doctor. But it is estimated that about 20 to 30% of GLP-1 prescriptions are coming out of psychiatry mental health practices. And the reason being that it has shown to be very effective in not only the weight management, the diabetic management, and so forth, but also in terms of addiction, different types of addiction, alcohol and other addictions. It has been shown to be even treating some treatment-resistant depressive conditions. So OCD, depression, addictions, there is good data coming out, and I wouldn't be surprised, with AI tools, because we can look at data faster. Then the cycle for data analytics have gotten shorter and shorter. Maybe in next 2 to 5 years, we will see how GLP-1s would be utilized more in psychiatric conditions, and the out-of-pocket cost is going lower and lower. Different programs have been coming out directly from pharma. For affordability, most likely FDA indication may not happen, so insurance may not cover, but the cost would be so low out of pocket that more people will use it. So yeah, I feel very, very optimistic about it. There was one comment I wanted to make about your work. Great work, by the way. Just from the equity point of view, if you think about it, generally 50% of folks are, men and women. Generally, when you look at it, there is such a little work that is being done in menopause, and that needs to be done. In fact, there are more programs right now which offer testosterone to men, even though there is no clear understanding of the diagnosis of a andropause or a menopause-like condition in men. and there is clear understanding of menopause in women, you would not find any programs online. Very few, I would say, count on the top of your fingers, that would cover menopause. So there are some equity issues. So if we are addressing personalized medicine from different angles, from genetics point of view, from medications, from therapy, whatnot, we also need to look at the equity in this. How are we addressing the whole body and not just limiting to back surgeries or cardiovascular surgeries, because those are decent revenue generator for healthcare systems. We need to look at whole body.
Let me start by saying that the way we need to think of technology is in a holistic way, not in a siloed way. And that's what we have done in ColigoMed, built a platform that can basically expand horizontally as well as vertically, take in new conditions, integrate with new devices, new EMRs. Essentially, once we have the data is gold these days, and AI cannot do anything without having the foundational layer of data. And we have AI embedded within our platform as well, but in the context of care programs that are essentially, prescribed to patients. And we work with a lot of metabolic psychiatrists as well as wound care doctors, and one of the key elements of that is the patient engagement and how we can monitor patients from their own settings keep making progress on that. Couple of things on the wellness side for the patients, we do through our app and through our platform, we are reaching out to them, not just through AI, but also through humans as well as through reminders, making sure that they're doing what they need to do on their care routine so that, they can live, they can manage their conditions and live well for a longer time. So those are some things I would say AI is here to stay. And the more we work with doctors who adopt AI, the better it will become. And we do have several doctors who are very passionate about using AI to make progress, to see better outcomes for the patients. So definitely, I think AI will last for a long time.
I think for longevity and mental health, I heard this statement in one of the other longevity conversations I was having with a provider, and I'll try to paraphrase it, is I want to die young at an old age. So I want to live as young as with the youth as long as possible until the old age. So from my specialty, and again, I'm shifting away from the whole body concept here for a second, is healthy lifestyle, but most importantly, create social connection networks, build new connections, enhance the existing connections. There is a value of using social network in building networks. So make that, because that is the single determinant at a population level, at an aggregate level, and at an individual level, how long either of us are going to live.
I will just mention again, probably. Please invest in women health. Like, happy woman, having everybody around. Honestly, it's such a obvious how her mood can affect everybody around, and especially when she's going through perimenopause. I believe if we address this transitional period correctly, we will have much lower rate of divorces, much better economic. We will have a much better life. That's why I think woman has a lack of support during this most difficult part of her life. And if we really address it well, we will have only benefits on it. Thank you.